The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, everyone. This is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Before we get started today, I want to remind you about my course called the Perimenopause Answer. If you are going through this phase of life called perimenopause, or if you don't know if you're in perimenopause, I would love to have the opportunity to talk to you about the course and see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I&B Podcast, where you can schedule an appointment for a Zoom call with me. It is a Zoom call with me, so when you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. I want to take an opportunity to thank those of you who have reviewed and rated the podcast. I'm so grateful to you for doing that. I'd like to share a couple of reviews left on the Apple Podcast app. Cindy says, "Thank you, Forrest, for the important role you play to make this podcast available every week. I am healthier because of Karen's help and advice." Thank you, Cindy. Tim's wife, she's labeled Tim's wife, says, "Every woman, young and old, needs to listen to this. So much helpful information. Karen is the best." Thank you, Cindy, and thank you, Tim's wife. Forrest and I really appreciate your kind feedback. I have had a couple of listeners and women in my perimenopause course who have asked me about iron deficiency anemia. So, to those who have inquired about this is your moment. Anemia occurs when you have a decreased level of hemoglobin in your red blood cells, which we call RBCs for short. Hemoglobin is the protein in your RBCs that is responsible for carrying oxygen to your tissues. Very important. There are multiple types of anemia, including hemolytic, megaloblastic, sickle cell, pernicious, and aplastic anemia, as well as anemia of chronic disease and thalassemia. I will not be discussing all of these types of anemia. I am just going to cover iron deficiency anemia, which is the most common type of anemia, and it most commonly affects women. It occurs when your body doesn't have enough iron. Makes sense? Iron deficiency anemia, which your body needs to make hemoglobin. When there isn't enough iron in your blood, the rest of your body can't get the amount of oxygen it needs. Amazingly, the condition is common, but many people don't know they have iron deficiency anemia since symptoms develop over a long period of time. It's possible to experience symptoms for years without knowing the cause. This is one of the many reasons to make sure you have an annual physical exam during which a simple blood test called a complete blood count, a CBC, as I mentioned before, is drawn and can tell us if your iron levels are normal. In women who are in their childbearing years, a common cause of iron deficiency anemia is a loss of iron in the blood due to heavy menstruation or pregnancy. A poor diet or certain intestinal diseases that affect how your body absorbs iron can also cause iron deficiency anemia. Symptoms are slow to develop because there are several stages that occur for iron deficiency anemia to develop. Normally, your body supplies iron to your blood from the food you eat. Your body stores excess iron, so it's available as needed to make hemoglobin. Iron deficiency anemia develops when your body uses up those iron stores faster than they can be refilled. And when the flow of iron into your system has slowed, this occurs in 3 stages. In the first stage, iron stores are depleted. In this stage, the supply of iron to make new hemoglobin and red blood cells is dwindling, but hasn't yet affected your red blood cells. The second stage occurs when iron stores have become so low that the normal process of making red blood cells is altered. You develop what's called iron-deficient erythropoiesis. I know. Don't you love that word? Erythropoiesis, which is the medical term for the process of producing new red blood cells. In this stage, your bone marrow makes red blood cells without enough hemoglobin. In the third stage, iron deficiency anemia develops because there isn't enough iron to make hemoglobin for the red blood cells. In this stage, the hemoglobin concentration will drop below the normal range. This is when you may begin noticing iron deficiency anemia symptoms. So, what are the symptoms that you would start to notice once the anemia becomes moderate or severe? Well, there is a long list of possible symptoms: general fatigue, weakness, pale skin or pale mucosa. For instance, the red part of your eye when you pull down your lower eyelid will be a pale pink instead of a deep red. Is an easy way to check. Shortness of breath, dizziness, a tingling or crawling feeling in the legs, restless leg syndrome, tongue swelling or soreness, cracks in the corners of your mouth, cold hands and feet, fast or irregular heartbeat, brittle nails or spooning of your nails, meaning your nails are concave like a spoon rather than being flat, headaches, chest pain, bruises, pica, a condition in which people crave non-food items like ice, chalk, paint, clay, or starch. Sometimes people even eat dirt. Additional symptoms include difficulty concentrating, chills, or cold intolerance. There are several causes of iron deficiency anemia. One is inadequate intake of iron. To maintain healthy iron levels, we need to eat a diet rich in iron. Foods that are high in iron include meat, eggs, and some leafy greens. Pregnant women and children need even higher amounts of iron in their diet to support rapid growth and development. Another cause is blood loss due to menstruation. Women of childbearing years with heavy and or long periods. Bleeding in your gastrointestinal tract. This can cause bright red blood or dark, tarry, or sticky appearing stools. Ulcers, polyps, inflammatory bowel disease, and colon cancer are medical conditions that cause GI tract bleeding. Some people develop GI tract bleeding after regular long-term use, again, regular long-term use of aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen. Inability to absorb iron. There are some conditions or surgeries that decrease the body's ability to absorb iron. Celiac disease or gluten sensitivity impact your bowel's ability to absorb iron. Also, surgery like gastric bypass changes the amount of dietary iron that is absorbed. Endometriosis is a cause, which can lead to heavy menstrual bleeding. Genetics can play a role in the development of iron deficiency. Genetic conditions like celiac disease, again, decreases the absorption of iron. Another mutation with a not so memorable name of TMRPSS6 mutation causes your body to make too much hepcidin. Hepcidin is HEPCIDIN, hepcidin, a hormone that can block your intestines from absorbing iron. Frequent blood donations can also cause this type of anemia, as well as blood loss from surgery. Certain people have more risk than others of developing iron deficiency anemia, and of course, that includes women who are still having periods, pregnant women, people with poor diets, people who donate blood frequently or need frequent blood testing. Infants and children, especially premature infants or those experiencing a growth spurt. Those who eat a vegetarian or vegan diet who don't replace meat with another iron-rich food. Teenagers who have a greater need for iron in periods of rapid growth. Adults over age 65. People exposed to lead in their environment or water. High performance and endurance athletes like marathon runners. If you are in one or more of these high risk groups, it is important that you ask your provider, such as a primary care provider or GYN provider, to order blood work to check for iron deficiency. Testing that can be done includes a CBC, again, a complete blood count, that measures your white and red blood cells, your hemoglobin and hematocrit, the size of your red blood cells, and the platelet number. Additionally, an iron panel can be ordered that usually includes an iron level, a ferritin level, which measures your level of stored iron, and a total iron binding capacity. These tests can also be purchased directly by you from companies like Life Extension or Let's Get Checked. When, as a provider, we are concerned that internal bleeding in the GI tract may be the source of the anemia, a stool test to check for blood in the stool is usually ordered. If that test is positive for blood, then we usually refer you to a gastroenterologist to have an upper and or lower scope done. The upper scope, an EGD, looks for bleeding in the esophagus, stomach, and upper part of the small intestine. A lower scope, called a colonoscopy, looks for bleeding in the large intestine. After this quick break, I'll share with you how to correct and prevent this type of anemia, so stay tuned. Correcting iron deficiency anemia involves replacing iron through diet and or supplements and addressing the underlying causes of the deficiency. That's so important. Oral iron supplements, either tablets or capsules, are often used to treat iron deficiency anemia. Many of these supplements are combined with vitamin C, which aids in the absorption of the iron. If possible, you should take iron tablets on an empty stomach, which helps the body absorb them better. If they upset your stomach, you can take them with meals. Iron supplements may cause constipation or black stools. You may need to take the supplements for several months or more. It takes about 3 months of supplementation to restore the iron stores. So, usually, the iron levels in the blood are not rechecked before 3 months after starting supplementation. For those who cannot tolerate oral iron, or if you have a condition that keeps you from absorbing oral iron, you may be prescribed intravenous or IV iron. This is usually a short infusion of 2 doses 1 week apart. One brand of IV iron that I prescribed in the past is called Injectifer. Increasing iron in the diet is another way to address low iron levels. Food groups that are rich in iron include legumes like peas, beans, tofu, and tempeh, breads and cereals like whole wheat bread, enriched white bread, rye bread, bran cereals, and cereals with wheat. Vegetables such as spinach, broccoli, string beans, dark leafy greens, potatoes, cabbage, Brussels sprouts, and tomatoes are also iron rich. Proteins, including beef, poultry, eggs, liver, and fish, including shellfish. And again, if you're vegetarian or vegan, tofu or tempeh are excellent choices for protein and iron. There are some fruits like figs, dates, and raisins that are also iron rich. If you eat a vegan or vegetarian diet, look for iron fortified breads and cereals. I just listed several non meat options to boost your iron intake, like beans, tofu, dried fruits, and dark leafy greens. You may want to take an iron supplement if you are vegan or vegetarian. Garden of Life makes a very good plant-based supplement called raw iron that does not contain a high dose of iron. However, if you opt to start a supplement like raw iron from Garden of Life, make sure you are getting your iron levels checked periodically to make sure your levels are not too high or too low. Again, in addition to supplementing iron to get your levels back up, your provider will be working with you to find and correct the underlying cause. If you are being treated for iron deficiency anemia, you might have to follow up with your healthcare provider every 3 months for a year or longer. Health complications can occur if iron deficiency anemia goes undiagnosed and or untreated. These can include rapid or irregular heartbeat, which can be serious, pregnancy complications, or delayed growth in infants and children. So it is important to tell your provider if you are an at-risk person and or you are having symptoms so a diagnosis can be made and treated promptly. Of course, I always want to stress measures to prevent diseases like iron deficiency anemia. You can prevent this type of anemia by eating a diet that is high in iron rich foods. Also, include foods high in vitamin C to aid in the absorption of that iron. Thank you for listening to and for sharing the podcast with others. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really do matter. I encourage you to visit our Facebook page, IMB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me so that we can chat about my perimenopause course and how it can help you if you are going through this phase in life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind the scenes work to make this podcast possible. Thank you, Forrest. As I mentioned before, our Forrest has moved to Baltimore to attend the prestigious Peabody Music Conservatory, where he has begun his studies to receive a master's degree in music composition. My husband and I were able to visit him and his partner recently, and it is fun to see that they are enjoying making Baltimore their home. As always, please remember, your health is in your hands.